This school takes a whole school approach to well-being by working collaboratively across the school community, ensuring that students feel supported, which positively influences well-being. A whole school approach to well-being means that every part of the school, including its policies, programs, and partnerships, work together to support the physical, mental, and social well-being of the students. A core component of the whole school approach to well-being includes the school's organisation, ethos, and environment. This establishes a cohesive, supportive atmosphere where goals can be achieved. The main goal of the school is to prioritise well-being through early intervention to foster happy, resilient students who can seek support and overcome challenges mentally, socially, and academically. The well-being team is a vital component to a whole school approach to well-being. This team consists of head teachers, year advisors, counsellors, learning support officers, learning and support teachers, deputy principals, and the school principal. The team meets weekly to discuss well-being goals, concerns, or opportunities for innovation. They are responsible for gathering and implementing resources, ensuring that well-being support is effective and available to all students. All school staff are encouraged to attend well-being meetings to be informed of current concerns or interventions in place. It is the responsibility of all school staff to be mindful of this information and commit to their role to support students and act as a mandatory reporter. Using elements of the Safe Minds framework founded by Headspace and the New South Wales Government and a variety of resources and programs, the Wellbeing team has produced a method of intervention, management and support of wellbeing that engages all individuals within the school community to support concerns such as anxiety, depression and emotional distress. The Wellbeing team has also organised programs that empower students to engage in activities that foster their strengths and enhance their overall wellbeing. This aligns with their goal to develop students' ability to seek support and overcome challenges. The Nip It in the Bud framework focuses on early identification of student difficulties, with interventions tailored to individual needs, ensuring students receive support before issues escalate. It operates through three key concepts: notice, inquire, and plan. Here, teachers and staff are guided to notice early signs of student difficulties. They inquire into the underlying issues by assessing the risks and ultimately making a referral via Central to notify relevant wellbeing staff. This referral is then used by the wellbeing team to collaboratively plan targeted interventions. This proactive approach allows for timely support and has proven effective in schools by preventing small issues from escalating, fostering a more supportive and responsive school environment. However, its success is dependent on staff capacity and consistency in implementation. Whilst mostly effective, it can often be affected by busy schedules, multiple wellbeing concerns, and new or experienced staff who are unfamiliar with the process. The stepped care model is utilised by teachers and staff within the school. The model offers a tiered guide to mental health support with varying levels of intervention that allows for their needs to be matched with the correlating level of support, ranging from classroom support to crisis support. Once the required intervention is allocated, follow-ups are organised if necessary. If there is a risk of significant harm, deputy principals are contacted immediately for follow-ups. The school is effective in implementing this system as it provides tailored support and early intervention. However, this framework also poses the risk of lack of effectiveness due to resource constraints. Observations of this include the allocation of additional classroom support, which was ineffectively implemented due to the lack of available SLSOs. The stepped care model operates on a strengths-based approach, recognizing that students possess abilities such as coping skills and resilience, which can help them manage their well-being. By prioritizing and building on these strengths, the model empowers students to draw on their own well-being management skills before providing additional interventions, ensuring that support is appropriately scaled to their needs. Partnerships and services are a vital component of a whole school approach to well-being, as they enhance support and resources, enabling a comprehensive approach to student well-being. STYMI is an anonymous referral service used by the school to prevent students from falling through the cracks in the referral process. Through STYMI, students can create detailed wellbeing referrals for themselves or others and identify potential intervention strategies. The referrals are instantly sent to the appropriate wellbeing staff, where they are then assessed based on the stepped care framework. This promotes a strengths-based approach to student wellbeing and recognition of student voice, as students are empowered to use their knowledge and skills to recognize warning signs of deteriorating wellbeing, allowing them to support themselves and others. However, since the introduction of the government's no phone policy, STYMI has experienced reduced usage, limiting access during school hours. To address this, the school could implement a STYMI iPad in the Wellbeing Hub, allowing students to make anonymous referrals on school grounds. This approach would also help minimise false or prank referrals, enhancing the strengths-based focus on positive student engagement in wellbeing. Additionally, the school has built strong partnerships with community organisations, including the local Headspace, police, youth centre, the Black Dog Institute, and other services, to implement targeted programming that addresses specific student demographics and needs. Some of these programs include wellbeing days such as Are You OK Day, where students engage in mindfulness activities led by representatives from the local youth centre and engage in seminars with representatives from Headspace and the Black Dog Institute. Collaboration between the school community, including students, family, and local services, allows students to feel a sense of belonging and provides them with the support necessary for personal development. This collaboration extends to ongoing communication between wellbeing coordinators and representatives from the Department of Communities and Justice, enabling the development of tailored support plans that connect students with necessary resources. These partnerships enhance early intervention efforts and contribute to supportive environments, fostering students' sense of belonging, resilience, and motivation. Curriculum teaching and learning is associated with embedding learning experiences within the curriculum that will equip students with the knowledge and skills to manage their well-being and foster a supportive learning environment. Through an abundance of structured programs that prioritize well-being education, the school conducts teaching and learning that is relevant and applicable to their context. Examples include mental health first aid sessions for Year 8 and 10, facilitated by the Wellbeing team alongside teachers from various faculties. These sessions include workshops and guest speakers. Incorporating guest speakers in learning programs poses most benefits when reinforced with information in both pre and post learning. This is achieved as the program runs fortnightly over the span of 1 to 2 terms, allowing content to be revisited and learnt in depth. By focusing on warning signs and symptoms of mental health issues, positive wellbeing maintenance, and support strategies for peers, the program empowers students to take an active role in their well-being and that of their peers. The strengths-based nature of these programs allows students to identify their skills and resources, fostering resilience and a sense of agency in managing their mental health. Additionally, the commitment from all staff to embed wellbeing support across the curriculum ensures that students receive consistent support regardless of the subject. This includes implementing mindfulness activities and conducting mental health check-ins. Teaching staff are also required to consider student-centered learning by adjusting learning for personalized learning plans to address individual needs within the classroom. It also ensures learning is context appropriate. Overall, the school's holistic approach to embedding well-being in teaching and learning significantly contributes to the supportive and responsive educational environment. The school actively incorporates student voice in the planning and implementation of its well-being programs. Whilst the well-being team is generally responsible for electing which students would benefit from each program, students also have the capacity to self-nominate themselves to be included within the well-being programs. Regular feedback is gathered through surveys and student representatives, allowing adjustments to be made in forming curriculum. Students are also involved in peer support SRC roles, fostering a sense of ownership and responsibility for the well-being of the school community. Students also have the opportunity to propose ideas for well-being programs to address support or issues within the school. Students can do this by proposing ideas to the relevant teachers or SRC representatives. An example of a successful program as a result of student voice includes the LGBTQIA+ club that was initiated by students with the support of teachers. However, it is important to note that utilising student representatives or relying on students to come forward with ideas is not always effective, as students often avoid conveying such information out of fear of judgment. This was evident within the school as there seems to be a culture amongst the students where they feel embarrassed to express themselves or ideas. Before my professional experience, I had limited understanding of a whole school approach to well-being. Now I recognise that promoting student well-being is a shared responsibility involving the entire school community. By collaborating with colleagues and fostering positive interactions, I aim to create an environment prioritising the mental, physical, and social well-being of every student. Through partnerships and services, I understand the importance of building strong relationships with students, parents, caregivers, and community services to create a connected school environment. This report encourages students to utilise available resources, including the wellbeing team and community services, as they feel a sense of trust, belonging, and reason to follow the guidance of another. Research shows that a community committed to wellbeing practices enhances student engagement. I prioritise this by staying informed about local programs and wellbeing issues and incorporating them into my teaching. In addition, regular communication with parents has often proven effective. During my professional experience, I found that keeping parents informed of their child's progress or learning activities led to meaningful discussions at home, positively influencing their children's attitudes towards learning. During my PECs, my understanding of how schools support wellbeing was limited, particularly regarding early intervention. I realised my engagement with the school's organisation for early intervention was minimal due to my lack of experience with the referral process and my limited relationships with students. which inhibited my ability to recognize behaviours of concern. However, I consciously respected the school's ethos by developing students' strengths in well-being and fostering a respectful classroom environment. Students are more likely to engage in learning when they feel open to express experiences, when they feel that the environment is safe. Feedback from my supervisor highlighted my ability to connect with students, making them feel respected and safe to express their feelings. When understanding curriculum teaching and learning, I learned to focus on student-centered learning practices, which promote engagement and enhance in understanding, ultimately improving well-being outcomes. I implemented teaching strategies that connected the curriculum to students' lives through relevant scenarios and activities, such as research tasks utilizing online resources. This approach made content relatable, empowering students to see the relevance of their learning and encouraging ownership of their education. Moving forward, I will conduct surveys to gather feedback on my strategies, aligning with the school's curriculum, teaching, and learning processes. I could improve by seeking more direct involvement in early intervention processes and actively collaborating with the wellbeing team and the school staff to strengthen my understanding of referral pathways and student support systems.